Fertility 1-to-1, clearing the air around fertility conversations. Let's talk. Today's conversation is on surrogacy with Dr. Gajendra Tomar, a renowned fertility and IVF specialist at Indore Infertility Clinic. When should a couple consider surrogacy? Like, what are the medical indications for surrogacy?
There has to be a medical indication to necessitate gestational surrogacy. For example, if there is a problem with the uterus, either an absent uterus or an abnormality in the uterus, which makes the woman unable to carry a child, that can be one indication. The other indications can be that suppose a couple has undergone repeated IVF cycles and has not been successful. So repeated IVF failures is also an indication for surrogacy. Repeated pregnancy losses. So somebody becomes pregnant but loses the pregnancy again and again and undergoes repeated pregnancy losses or miscarriages or abortions. That also is an indication for surrogacy. Some of the other indications may be like there's a medical condition because of which the mother is unable to carry the child, and the medical condition is life-threatening for the woman herself. For example, if somebody has undergone a renal transplant and is on immunosuppressants, and if she becomes pregnant, her medical condition might worsen. Or suppose she has a heart condition because of which the cardiologist or the heart specialist has told her that if you become pregnant, it may be life-threatening for you. So these are the indications or the medical reasons for which a couple or a woman can avail the facilities of surrogacy.
Is there any congenital abnormality for which surrogacy is usually suggested?
Abnormalities of the uterus can either be acquired or congenital. Acquired is like if somebody undergoes a hysterectomy because of some disease of the uterus like fibroids or adenomyosis. Some uterine conditions can be congenital, like congenital absence of uterus, Mayer-Rokitansky-Kustner-Hauser syndrome, or what is commonly known as MRKH syndrome is one such example wherein the uterus is congenitally absent and therefore the woman is unable to carry a child. There are other congenital defects like unicornuate uterus or very small uterus or hypoplastic uterus, or a bicornuate uterus wherein there are two horns but both the horns are very small and therefore the woman cannot become pregnant. So these are some congenital conditions of the uterus. Yes, there are congenital conditions which basically the only option for such women left is either surrogacy or adoption.
So can a couple opt for surrogacy if they already have one child?
Surrogacy currently is limited to couples who are childless. That is, they do not have a child or children of their own. The only exception to this is if the child that they have is suffering from an illness which has no cure. It is only in that situation that the couple can apply for surrogacy. Otherwise, generally, surrogacy is only for childless couples.
Another concern which most of the intending couple have is that after a child is born through surrogacy, what does the birth certificate of the child mention in the mother's name section?
The mother's name will be the intending mother's name. The surrogate's name is not mentioned on the birth certificate as per the current law. So it is both the intending mother and the intending father's name who will be on the birth certificate, and there will be no other name.
So this is one of the fears that most of the intending couples have, that can a surrogate mother withdraw her consent for surrogacy after pregnancy?
The surrogate mother can withdraw her consent for embryo transfer before the procedure of embryo transfer itself. But once the embryo transfer has been performed and once the surrogate is pregnant, then the only indication for discontinuation or termination of pregnancy can be taken by the medical team. So it is the medical team who will decide, not the surrogate. So if the surrogate decides one fine day after becoming pregnant that she does not wish to continue this pregnancy, she cannot do that. She does not have the right to discontinue this pregnancy, which is otherwise medically fine, and she will be liable for prosecution because that is what the contract has stated. So the surrogate cannot discontinue pregnancy on her own free will.